So I will go ahead and get started. Welcome to the 2026 Countywide Nonprofit Services Workshop and Q&A. I am Jake Berghaus. I'm the program manager on this program, and I'm part of the Hamilton County Department of Community and Economic Development. Also joining me are my supervisor, Angela Rockman, our community development administrator, and Chase Poindexter, our intern for the summer. All right. Go start off with a little agenda overview. So today we will cover a quick program overview. We'll go over program eligibility, requirements, and specifications. We're going to cover the eligible services and uses of funds for this program, as well as our participating communities within the county. That'll be an important one to keep an eye on. We'll also cover the community-based development organizations and eligible services. When we get to that, that will make a little more sense. We'll cover our evaluation and scoring for this RFP, and then we will kind of go over some of the more the requirements that are going to be more about while awardees have the grant. And so those will include things like timeliness, goals and accomplishments, and which we will be are required by HUD. And then also we'll cover subrecipient responsibilities and monitoring on our end. And I didn't put it on the agenda, but there is going to be a resource slide as well. And then we will, of course, get to questions for this question and answer session. All right. So every year, Hamilton County receives a entitlement of community development block grant funds. We're what's known as an urban county. And so with that, the county does receive an entitlement of block grant funds for the community, any community within the county that does not qualify for its own entitlement. There is only one community in the rest of the county that qualifies for an entitlement, and that is the city of Cincinnati. So our program year award for the total block grant was around $3.4 million. And CDBG allows up to 15% to be spent on public services annually. And from that, we every year issue an annual request for proposals for this program. This program is open to nonprofit agencies only. Local governments and for-profit agencies are not allowed to apply. This year, we plan to expend up to $500,000 on public services. This set aside includes a set aside only for CBDOs that will be performing certain public service cap exempt activities. Got myself tongue twisted there for a second. And we'll cover that more in depth later on in the presentation. A major point of the CDBG program is taking care of three national objectives. The first is to benefit low and moderate income households. This includes households up to 80% of the area median income. The second national objective is to eliminate slums and blight. And the third is respond to urgent needs. And I mark this as rare and because it's basically just like disasters, be that, environmental or, fiscal or something. There's disaster. That's all you need to know. All of our activities through this program will fall under the benefit, the low moderate income benefit national objective. Um, and it is a requirement that every activity funded through CDBG funds meets one of these three national objectives in some manner. So just kind of hitting on the timeline for this RFP process, we did release the specifications on the 29th of June. The application did open up this past Tuesday. I know that was a little confusing. Just need a little more time to get most of the kinks ironed out in Neighborly and that. Plus, it was like, a little time to take a look at the RFP first. We're at the Q&A, obviously. Yes, I will be sending the slides for the person who just asked that. It will also, all of this will be posted on the our website for the program page for this this RFP. So it's all, I think, everything but the presentation and the recording are there already, like all the resources and stuff. So that will be this will be added once I have the recording. Deadline for submission of questions will be the 17th of July, and I will have those posted, all the final run up on by the 20th. Sorry. Deadline for submissions will be on July 27th at 5 p.m. Staff review will be conducted the week of July 28th through the 31st. And we will send their recommendations to the county administrator the week of August 3rd. And then in August and September, we will be working on presenting those recommendations to the county commissioners and working on contracts and getting all of that settled and executed. Yes, I did see that. Just for a note on Neighborly, that was one thing that I didn't notice until late yesterday, and I'll have our rep correct. It will, on the application, it's going to say 2025. I assure you it is the 2026 application. I'll get that corrected. Apologies for that. Okay. So just moving into the eligibility requirements and specifications for the program. As I mentioned, the program is open to applications from registered nonprofit agencies serving residents of Hamilton County outside the city of Cincinnati. Your organization may be located in the city of Cincinnati. Your services could be provided in the city of Cincinnati as long as they're being provided to Hamilton County outside of the city residents. This has to do with our separate entitlement streams between the city and us. I don't make the rules. I just follow them. Local governments, like I said, are not eligible. For-profit organizations are not eligible. Those CBDOs are, by regulation, allowed to be for-profits. For our RFP, for this RFP, we are only accepting applications from nonprofit community-based development organizations. Funded agencies will be subrecipients as defined by the federal government. Essentially, that puts program administration, the responsibility for program administration onto your agency. And you will become what's known as a non-federal entity. I know a lot of you are from agencies that have managed federal funds, so you're pretty familiar with this, but it is, I think, worth covering as you are assuming a lot of responsibility by taking these funds, almost on equal footing with the county. You basically are just exempted from our monitoring that we're responsible for, so which makes sense. The minimum funding request for the RFP is going to be $25,000, and the maximum will be $125,000. I know in years past we have not had a maximum, but frankly, that made trimming asked to a number that was kind of reasonable to fund multiple agencies very difficult, and so we figured most of the time we're not rewarding more than $125,000 for any award, and so we thought that was a good cap. Lets us fund multiple agencies, lets us not, tank someone's $300,000 budgeted program, so at the outset. All applications must be complete. They must include all of the required documents, and you must use the provided budget template. I know it seems maybe kind of silly, but it means everyone is using the same template. We can judge them against one another, and everyone internally uses different spreadsheet or systems, different reporting mechanisms, this, that, and the other. We just want it to all look uniform, so it's easier for us to go through it and compare and that. The proposed services must fulfill a national objective, just as I said, and it must be an eligible public service under CDBG regulations. All agencies must be prepared to deliver services to the intended beneficiaries by the contract start date, which is October 1st, 2026. See, that's where it is, the 2025. I just wanted to be 2025 again, I guess. The term of the agreements will be 1 year, so that'll run from October 1st to September 30th of 2027, which is our program year. All beneficiaries must be residents of one of the 43 communities that participate in Hamilton County's CDBG program. Residents of the city of Cincinnati are not eligible. Also, for other jurisdictions which do not opt into our program. And I'll cover that a little bit later. Awarded agencies must upload monthly progress reports, requests for payment, invoices into our Neighborly portal. I'm going to be a lot more strict on making sure folks are on time with reporting. That has been a little bit of an issue, and it's not. I will take some onus on our end. I think those of you who have been awarded or been in the process before know that in years past we started the process later into our program year. Our program year used to start in July, and we weren't getting contracts executed some years until no, Price Hall would not qualify. And some years we were late. This year we're not going to be late. Latest I plan to have anyone's contract executed is mid-October, and also we're not going to have which is, on us, we don't know if we're going to have the funding, so we can't budget until we have that. So that's our goal, is get the program moving and going on the timeline that it should be. So next, all agencies must have a system to collect income and demographic data for all program beneficiaries. This data must be provided in the format: accomplishment type, income levels, race, ethnicity, elderly, those, all the demographic info, which I'll cover in a bit, that's required. When I say accomplishment type, HUD counts by people or households. That's it. That's what we count by. So we can't count by a number of some service you provided without number of unique beneficiaries. We need that number of unique beneficiaries being served by these funds. That's how I report. That's how it gets reported. That's how HUD does their data analysis. If you have partners and you're distributing, I mean, the easiest thing to say is meals, your partners are going to have to be able to provide you numbers on unique clients served. This is just what it has to be. This is how HUD requires it. I don't. It's I know it's difficult because I know people's systems are different. You know, I know some folks are using a percentage of poverty level for your income qualification. That's fine, but you're going to have to translate that to the HUD income limit or the HUD income levels, which are 30, 50, and 80% of AMI. And I have a income calculator that we link to that you can use to hit those levels. It'll shoot you a printout, and there you go. You've got it, and you know what it is. So I know that can be an administrative burden, but that is that's just how it is. So next, kind of talk about the administrative requirements and federal requirements. So you must be able to adhere to all the federal requirements, specifically those regarding cost principles, audits, and uniform administration, internal controls, and the like. That is Part 2 or CFR Part 200 or 2 CFR Part 200 is where all of that is. Those agencies who have those agencies that have had federal funding before, you're going to have these systems, those policies that you have to have, you know, the like succession planning, the different privacy policies, ADA policies, et cetera, et cetera. I do have a resource for that. That does include all of that. And I believe a lot of you with your finance folks should be able to figure out your level of either current or ability to comply with those requirements. Also, of course, this is the community development block grant, so you will have to also follow all the requirements of the community development block grant program, and that's located at 2 CFR Part 570. But I have better, less, you know, mind, you know, crazy, what do you call it, regulation speak. Plain language, that's the word I'm looking for. Plain language explanations of that stuff for you as well. So this year, these are the eligible public services that we're focusing on. If you've seen the RFP, we do have 4 focus areas for services this year, and those are the 4 that are highlighted in green. This is not an exhaustive list of our of public services through CDBG. These are just the ones that we either are approving and or prioritizing. So we have for the priority ones, we have healthcare, food access and security, education and workforce development, and eviction and foreclosure prevention. Other services that are eligible are senior services, youth services, child care, legal services, homelessness services, and public safety. There are other eligible services outside of this and that are eligible, and you're welcome to apply. These will just, they scored. These ones will score, and any not on this list would not will not score the same. Eligible uses of funds. This year we wanted to really kind of pare down basically where our eligible uses are generally going and where we have capacity, know-how, and just effectiveness of the funds. And so what we found is, I mean, by and large, labor is our big one. We want you to pay your staff with our funds. That's what we really want. Like that is our number one. It's our I know one, it's sometimes hard to get funding for salaries and positions, and two, we know how to do this. We've been doing it for a long time, or at least me personally. So I'm very comfortable with, approving and looking at and being able to review all that and guiding folks through labor and those costs. Direct to financial assistance, same deal. This would be things that, you're going to think of like emergency rental assistance, utility payments, security deposits, course fees, or like if you're doing legal services, maybe you have to pay for some documents or things like that, or you're helping, do some resource navigation. You pay for someone to be able to get get an ID or cover that cost. Just so you know, you will pay any of these things directly. Your agency will. You will not hand this money to your clients. But that's how that works with direct assistance. And then kind of down the list, the supplies and materials necessary for providing your services. That being said, that does not include any major equipment, furnishings, laptops, cell phones, any like really major capital expenses. It's a lot to wrangle with those things. It's a little harder. So we just want it to be like things that are directly basically being used to day in, day out do your programming, as far as like, I mean, you need paper, office supplies. I mean, very, very basic. I really want to kind of steer everyone towards the first two. And as far as, I forgot, I didn't cover the labor breakdown, but what that can actually cover are salaries and wages. You can cover benefits. You can cover your taxes, the employer's taxes. Basically, you can't with benefits, you can't pay them for like their PTO, but you can cover costs for like the employer side of health insurance, dental, retirement, et cetera, et cetera. Oh, all right. I have a lot of questions in the chat. I'm going to stop because I know a lot of them are directly related to this, and I'm just going to go ahead and hit a couple of them right now, and then we'll come back for some of the more complex ones. Medical and dental, yes, could apply. You would just have to, it would be like paying for the service itself. And as far as labor, as far as the labor costs, that does have to be for employees who are directly working on the program. So you can't, your labor for like administrative staff, they would not be covered under this because that would be kind of considered like an indirect cost. If they are working directly on the program, you can bill for their hours that they're directly working on the program. Let's see. And then I think Angela covered that one. And Jamie, with the residency for home ARP, the residency for CDBG, I have to check. I am not as familiar with how that would be done versus, because I know that gets, if someone's home doesn't have a home, what are you calling for the residency? So I'll check further into that and get a better answer. And then same with food and snacks for all day trainings. I know we can't pay for them generally, but I know there is, you're allowed to pay for food, like food assistance, but I'll have to check for sure on just like refreshments, so to speak. And then if I missed any others, we will go back through and I'll make sure that I'm hitting those as when we get to the question part. I just think some of those were pretty relevant to what I was just talking about and wanted to not miss those. Ineligible costs. Some of these, I'd say most of these make perfect sense and are pretty standard for all federal funding, but CDBG funds cannot be used for the following costs or expensive. Administrative or operating costs that are not directly tied to the services being delivered, indirect costs that are not permitted by CDBG regulations, that aren't adequately documented, locable to the services being provided. You can't lobby or pay for political campaigning with these funds. No capital expenditures, as I mentioned, and any other costs that would just generally be disallowed by the federal government or federal regulations. In addition, we are putting just hard nose on a few of the eligible costs, no matter what, even though I've kind of already said that we only want to do those three. But just to really drive it home, we will not cover for equipment, like major equipment. We're not buying you a laptop, sorry. Operation and facility costs, utility, rent, maintenance. That gets trying to figure out portions of buildings that are used for the funds, and that's a lot of a burden for you. That's a lot of burden for me, and it's just tough. And I think there are better things to spend the funding on directly. And finally, indirect. Speaking of direct, we do not cover indirect costs with this grant. Participating communities. So as I mentioned, we do have 43 of the 49 communities in the county that participate in our program. As I mentioned, the city is not one. I think Angela posted the other four, which opt out, or don't opt in, which are Evendale, Blue Ash, Indian Hill, and Terrace Park. Otherwise, if your folks are from any of these other communities in the county, which I mean is at least 65-70% of the area of the county, then you're good to go. I'm not going to read every community off, but this will be available, and it'll be in your contracts and all of that. So you'll see this list a lot. I know we locally have a lot of like neighborhoods that are kind of like, where's Finneytown? Which is it in, that kind of thing. And so just making sure that the area that the person lives is actually in one of these jurisdictions is important. My recommendation is to use either the auditor's website or CAGIS's web map, because when you pull those up, it will actually, and look at the property, click on the property or search the property, it will actually tell you which jurisdiction it's in, it'll be City of Cincinnati or North College Hill, et cetera, et cetera. The reason I encourage that is because I know a lot, because zip codes are difficult. They are not based really on, they're not at all based on jurisdiction, other than, loosely. By and large, though, it's more about population size or area size. And I think we all know that a lot of, especially in kind of those inner ring first suburb areas, those are getting split. Some of those are split between 2-3 jurisdictions, and some of those may be a jurisdiction that is, qualifies, and some may be ones that don't. So I recommend using a method that other than zip codes. But if you do have a system with the using zip codes, then and it works and you can still do it, be my guest. All right, so CDBOs. Oh, I did do that wrong. I'm just going to be honest, I always get tongue tied and I always flip the B and the D in this one. CDBG, CBDO, yeah. CBDOs are community-based development organizations. And this is a organization that's organized under state or local law to engage directly in community development activities. They can do a wide range of activities. They can do things like workforce development. They can do, slum and blight kind of like actual like construction type projects. It's pretty, they got a pretty broad brush. But for this one, we'll be focusing on the public service aspects of what CBAOs can do. Their primary purpose is to improve the physical, economic, or social environment of the geographic area in which they operate. A CBDO must have a set geographic area to be a CBDO. So that means, and I think, everybody has a service area, but you just have to have a stated geographic bounded service area, if that makes sense. You can be a nonprofit or a for-profit as a CBDO, though for our program, we are only accepting applications from nonprofit CBDOs. CBDOs can't be a instrumentality of a local government. They can't be directly beholden to or essentially a arm of any local government. Board members have to be nominated and approved by the general membership or by governing body of the organization. Your organization cannot be subject to reversion of assets to any jurisdiction except for the federal funds that are under control of the agency. And then you have to be free to contract for goods and services without any, like on your own. So what makes a CBDO? The big thing, besides that geographic area, the next thing that makes a CBDO certifies as a CBDO, sorry, is that 51% of the governing body needs to meet one of these three criteria. And that is either low and moderate income residents of the geographic area of operation, owners or senior officials of private establishments such as businesses or nonprofits actually that are not you, or other institutions located in and serving the geographic area of operation. And representatives of low and moderate income neighborhood organizations that are located in the geographic service area of the organization. Also, there is a cap on the number of members of the board that can be elected officials. Application requirements. Submitting a completed application that will include the CBDO application, current bylaws, IRS 501c letter, and a description or map of the service area for the organization. We'll also need a copy of your board roster and self-certification forms for of any of those three. Each one, course A, B, and C correspond to those three different types of qualification for that. And that would just be submitted by the members of your board that qualify under one of those three. So say you have a 10-member board, 6 are going to qualify for that. I only need forms from 6 people because the other ones, there's not a, we don't qualify for them. Why this is important is within the funding pool, we have a set aside for CDBOs or CBDOs that will perform workforce development activities. And part of the reason for this is that certain CBDO activities are not subject to our 15% public services cap. So what this did was allow us to bump this cap or this funding pool all up to that $500,000 mark. That pool's about 50,000 just for transparency. There's some, dollars and cents there, but that's what that's about, and that's why we're doing kind of this carve out. This is included as part of the total funding availability for the RFP, but can only be awarded to certified CBDOs. CBDOs will be funded from this set aside in order of score until the set aside is depleted. Any remaining applicants or like fund pool, maybe overage would be considered against the scores from the total pool of applicants. Evaluation and scoring. So we have, this is one of our big change. I know a lot of folks in the room are very familiar with this application, this program. The application and the scoring and a lot of this is going to be significantly different than in years past. One major thing that we've done is I've totally revamped our scoring. We had a lot of I would say measures that were overweighted, and I think a refresh was time. So we have four categories under scoring: project description, budget and financial capacity, organization information and experience, and goals and impact. Total of 100 points. Organizations will need to score at least 70 points to be considered for funding. That has generally not been an issue. I don't think we've ever, in the years I've been here, I don't think even with the previous scoring, we've ever funded an organization that scored less than 80. So, and there are lots of organizations that meet the threshold. So it's, I think a threshold is just kind of a good idea. For project description, it'd be 10 points, where the project description adequately describes the proposed activities and demonstrates the quality of the project design. 10 points total possible for addressing a relevant data-driven need within the county or the specific area in which you're intending to target within the county. And 2 of those would need to be on the list of our high need population jurisdictions. That is included in the RFP. And there's, I think, 7 of them total. Demonstrated community support and collaboration, and that your facility is appropriate to carry out the proposed activity. And project addresses one of the 4 priority public services. All of these scoring metrics are based on kind of a 5 to 1 or 1 to 5 point scale, and then doubled if the total is for 10. And you can see that full breakdown in the RFP specs as well. For how that goes, the one exception is this the priority service areas, and that would just be 5 points if you're going to be doing one of the 4 priorities. 2 points if no, but it's on the other eligible activities list, and 0 points if it's not on our short list or it's an ineligible use. And if it's an ineligible use, you've got a bigger problem. For project budget, financial capacity, obviously we want your budget to be accurate, should be reasonable, necessary, and totally related to the proposed activity. Demonstrate, be able to demonstrate acceptable financial management systems with experience, capacity to manage federal funds. This is that kind of that CFR 200 uniform requirements stuff generally, but also just kind of a judgment, the overall capacity of the organization, kind of the size relative to size of the organization relative to robustness of your finance department. Considerations will include past performance with any local, state, or federal funding programs as demonstrated in the application. Also, those the experience of your finance staff, as I kind of mentioned, your organizational policies and procedures. This will also factor it in. I said local. Yes, that will factor in prior performance with our funding as well. Commitment of other funding sources and leveraged funds, looking at the strength and reliability of those other funding sources, and then clearly outlining a detailed plan for financial stability or sustainability of your project or your activity, your service. Organizational information and experience. We're going to be looking at demonstration of relevant experience and qualifications to manage the project, the activity, to perform the services. If you say we're providing health services and you don't have a it's not, nobody's a doctor, so to speak. That's going to be a red flag. Organizational infrastructure and staff planning that are appropriate for the scope of the project and the services that are being provided. And then board represents a range of stakeholders and community members. And then finally, goals and impact, clearly identifying and describing past and proposed outputs and outcomes. Demonstrated success and successful lasting benefits of your program for the community and participants. And then your program goals being realistic and achievable. This will consider things like number of persons served, outcomes for clients, and overall community outcomes. And then the further I know I'm going to say this a lot, further breakdowns of each individual categories points are in the RFP specs. All right, so now we'll kind of move into even more of the kind of HUD requirements, which is timeliness, goals, and accomplishments. HUD requires grantees to ensure timely expenditure of CDBG funds as a measure of impact. This is known as our annual timeliness test. Because of the public service cap and some of the other regulatory things, that's why we run these RFPs through our program year, because it's more than any other type of CDBG project. This is really tied to the time in which it's spent. And so we have like an origin year cap and a single year cap, and I'm not going to get into that, but it's a whole lot. So we have to get these funds rolling is the main gist of this. Subrecipients will be required to upload monthly progress reports that will include like a narrative, that will include your accomplishments for folks served, as well as any invoicing or request for payments that you had from that prior month. Data needs to be tracked for individuals and families considered low to moderate income, defined as 0 to 80% of the area median income. Race, ethnicity, address, and other demographic data must also be collected. Goals and accomplishments for number of persons and or households to be served by the subrecipients will be reported to HUD. in our IDIS system, and that's why I made kind of a big deal about the counts and how that is counted, because that's directly like regulatory how we have to count it. And then with some of the income certification stuff, I know folks have said or kind of asked about, I've seen kind of off to the side about other ways of qualification. I will cover that in a moment. As I said, your goals should be realistic and achievable for the number of qualifying unique beneficiaries, county residents, that you can actually serve. One of the things that I like to say in our like a post-award meeting is that goals are nice to achieve, but expenditure and reporting are not. Or sorry, goals are nice, but compliance is required. I knew I had a better. Sorry, I'm a little scattered. I'm having one of those public speaking difficulty days. Next, income qualification and beneficiary data. Like I just said, all beneficiaries of CDBG funded public services must be qualified for eligibility for the services. The methods available will depend on the national benefit objective type and the service that's actually being performed. Like I said earlier, typically this is going to be the low moderate income benefit national objective, and within that it is going to be either area benefit or limited clientele. We have not done an area benefit since I've been in our department, but it is something we can do. We typically do LMC, which is limited clientele. The distinguishing factor between these two categories of area benefit and clientele benefit is whether the service will be offered to all residents of a particular LMI area, which means 51% of at least 51% of the residents of that area are under 80% of Area B income, or a particular group of LMI residents are going to be served countywide. So basically kind of an individual qualification sort of deal. Income qualification and beneficiary data related to these two qualification types are going to look different, and they're even going to look different sometimes within the category. So limited clientele requires that you serve at least 51% LMI residents, as evidenced by documentation and data concerning beneficiary family size and income. Or you have income, and that's direct verification. That's what that is, direct verification or certification. You could also have income eligibility requirements within your program, which limit the services to persons meeting that LMI requirement, evidenced by your procedures, your intake forms, your income limits, and other source documentation. Next one is what we call presumed benefit, and this one will look different. So you can serve a group that is by HUD considered to be primarily low to moderate income, and this says such as, but really this is the list: abused children, battered spouses. Yes, these are very old terms. This needs to be updated. So we'll say domestic violence survivors, elderly persons, severely disabled adults, persons experiencing homelessness, illiterate adults, persons living with AIDS, and migrant farm workers. And each of those, with that presumed benefit, we'll get into that with the reporting, but each of those will actually have like one of the 3 income categories that you can just slot people into if they meet that presumed benefit. Yes, Susan, they can, and we will cover that in a moment. And then finally, for LMI, limited clientele, the last way to certify would be that the activity is of such a nature or is of such a nature or in a location that it may be reasonably concluded that the activity's clientele are low to moderate income. So yes, this is the thing that's going to kind of include things like where you, especially where you have kind of passing relationships with clients, things like food banks, soup kitchens, that stuff. You're not going to need to do a formal income cert on everybody, but people are going to have to sign in at least. Like there has to be a tracking mechanism for individuals. That's where that is. And if you're kind of doing a pass-through thing for your service or whatever, then you're going to have to be able to get those that data from your partners. And that would be the same if I mean, I'm going to pick on Habitat, but like their workforce development program runs through CityLink. They have to, if CityLink's doing the intake, they have to be able to have access to that intake information and data to be able to provide to us, or CityLink has to be willing to provide that data to us. And we're not looking for like a personally identifiable information. We just want you to have that system that we know in place, that you're counting unique individuals as best you can. And in most cases, actually counting unique individuals. I mean, I think for most folks, honestly, doing the self certs or the actual like the means testing, I guess, type or income certification. I think a lot of you already do a lot of that, and I think that's going to be baked in. But it is just kind of CDBG has finicky requirements that don't line up with a lot of other federal funding, and so that's why I like to make sure that I'm kind of hammering that home. Moving on to the area benefit. So
I'm confused.
Okay. Confused on generally or which or something specific? Okay. Well, if we'll do questions here in a moment. I've just got a few more slides, and we can. I know I'm throwing a lot of info at you, so happy to get to clarify. For any activities that would be qualifying under area benefit, you'll have to maintain records of the boundary of the service area, maps, that sort of thing. HUT specifically, like a map of like census tract data that's evidencing that they are qualifying for that. If you're looking to do that, I can provide resources and links to be able to create those sorts of maps or look and see, hey, are these census block groups or tracts going to be qualify for me? You'll have to document that the area is primarily residential, and also document that the income characteristics of households in document the income characteristics of the households in the service area. And that's, like I said, that mapping census data, American Community Survey data, which again, HUD releases maps on this. So if you're thinking area benefits to your way to go, let me know. Just email me. I'll link that stuff to you. All right, income qualification and beneficiary data. As we said, by and large, if you're doing LMC, we are going to need you to do intake and to collect this data. So here's a copy of just a kind of a form that we give to you. You can use it. You cannot use it because I know a lot of you are digital these days, which is the way to go. Some of you are using HMIS, things like that. And so as long as you are collecting all of the data that we need through your system, then your system is fine. And yes, as Angela pointed out, this is an older form, and I will have an updated form with the new income limits available. Really, I think more for the purpose of this is, or for my, at least for my on this end, was just showing kind of what is going to be included. Subrecipients must track this income and demographic data for their program beneficiaries. The type of income certification that is appropriate will have some variation, as I mentioned, based on the activity type, the nature of the services, level of ongoing relationship, etc. Yes, self-certifications are allowed in many or in kind of in most cases. The things where you would we really need actual income documentation is anything that's direct, like monetary benefit or like a of some sort. So like if you're doing rental assistance, you have to verify that that's not self-certification is not good enough if you're doing rental assistance. Um, but like I said, if you're doing, food, a sign-in sheet that says something at the top that I certify, or even just here's a form. Can you sign this waiver for me? That says I certify that my income is under this level. Da 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 da. That's going to work in most cases. If you're worried about having a good self-certification form, the HUD income eligibility calculator, the what we're going to do is what that does is you put in the info like their household and the area and all that stuff, and it'll spit out like, okay, they can go up to this amount, and that if they're over this amount, they're ineligible. What it also will give you a opportunity to do is print a self-certification form, and then you can give that to the client for that. And we will still need the demographic data for those self-certifications. So that is going to be, I think that's usually the hardest part. And then, yeah, I know. And of course, you can't require them necessarily to identify, but you have to at least be attempting to collect that data. And then there are ways for us to do estimates based on population or clients that serve, but you have to be attempting, and you should be collecting it for most people. I think most folks are fine with it, is what I've seen in my experience. Let's see. Presumed benefit populations will have specific ways to report their income level. You will have to do some sort of, with those presumed benefit, you will have to do some sort of verification or certify that they are indeed part of that population. I mean, senior citizens, you're going to need to see an ID. If it's domestic violence, that I will have to check, but I would assume a intake worker cert or referral or something like that would work. Well, I know it will work. I that might even be able to be self-certified. I know I can self-cert. You can self-cert that in HomeARP. I'll check for sure on that one. But if you have specific questions on how to certify each of these, or what kind of documentation you would need, we can talk about that. And that does include the homeless population as well, for those of you that are serving that population. Subrecipients, again, I'm hitting back on the reporting and neighborly. We just need the reports. We need them. We want them on time. I will say, if you talk to me and let me know what's going on, I don't know, say you're your whole email server, your whole server for your data went down and you are scrambling. Yeah, you can have time on that report. It's just talk to us, communicate like that. Don't duck me. That's just don't duck me. Our reporting for CDBG is based on number of individuals served. Some things are household, but generally for public services, the way it's going to go is going to be by individuals. Account of number of services goods provided are not going to be sufficient. So, like, say a number of meals or just a number of um, like a number of dental services. Like, what I need is like how many people receive those meals, how many people, you did 10 dental services, but each person, if it's actually 5 people sort of thing, you know what I mean? Like, then that's 5, that counts 5. If your agency is unable to collect the data or provide it one reason or another, you're not eligible. I think you can figure out systems. There are ways to do it, but we do have to have this data. I know I'm hammering the data. We're in a data world these days, and HUD wants the data. Commissioners want it too. So promise getting close to the end on these slides. Subrecipient responsibilities and monitoring. Community and economic development will conduct ongoing oversight and monitor subrecipients throughout the term of the agreement. We will monitor subrecipients based on the goals and performance standards outlined in the subrecipient agreement. Regulatory compliance also is a major factor, and most of that is why those things are included in the agreements. And generally, in years past, regulatory compliance has not been our highest priority on monitoring. That is not the plan this year, and we are going to be focusing on the robustness of those systems and that regulatory compliance, and kind of doing a deeper dive on that. And just kind of going over a general overview of what these monitorings will kind of look like, and what we'll be looking for is document review of like policies, procedures for compliance with those regulations, how you're doing your beneficiary qualification. We're going to take a look at the you have to be insured to get this grant with the county. You have to insure the county, but we will kind of ask about your other broader insurance for the agency. We'll look at your marketing materials. We'll look at budgeting and versus your actual expenditures for the program. We'll look at your service reporting. We'll discuss how you do your file maintenance and your policies around retention and things like that. If your facility is accessible or appropriate for the services that you're actually providing in your facility. And then just generally looking at policies, procedures, and there will be other things that are covered. I'll send you that exhaustive list later, as many of you know. And then finally, as I said, resources and references. Right here, I've got links to the HUD income eligibility calculator, which is where you can print off self-cert forms. You can do your that income. It'll spit out like, how much a household of 6 can make at this, that, and the other income levels. Also included links to our CBDO checklist and application. Those can also be found just directly on the landing page for this program on our website. Playing by the rules, a handbook for subrecipients on administrative systems. If you really want to get into it and really see the plain language of the requirements for this federal funding, that would be something to take a deep dive in. I'll be honest with you, I have not read that thing cover to cover, but I have referenced it a lot. And we have one that's on the flip side, that's the how to manage subrecipients, and I've really referenced that thing a lot. So this tells you how to do it. It's in plain language. It's not in legalese or regulatory language. And so I've linked that. Just be aware that the way I had to download it, each chapter is separate, and I didn't want to mess with the linkability that was in the document and merge it. So that's why that's like that. So you'll still be able to click on the table of contents subject that you want and actually go to that page. And then finally, I'll have the updated beneficiary questionnaire posted to the website as well. The old one's on there now, just for a look at, but I will have the new one posted this afternoon, actually. So, because that's basically the only thing I have to change is the income guide levels. And with that, we will now get to the question portion of the day. First, I'll kind of go back through. We can go back through and see. I'll go, let's see, what level of documentation are you expecting for income verification? So for most direct source documentation, we would we need pay stubs or, like you said, SSI letters, those sort of things for all income sources, for all household members, for those needing that level, for those things needing that level of documentation. You will need at least, I would prefer you get 90 days, but 60 is the bare minimum for pay stubs. And then best practice is always getting tax document from most recent tax document, just to, as kind of a check on any variation you're seeing that the client isn't able to reasonably explain, let's see. What are the most common mistakes applicants make? I can tell you it's the budget. It's the budget. Every year, unbalanced budgets, things that don't make sense, not using the budget template. That's honestly easily the most common mistake, is that. Our budget template did stink before, and that's why we were a little more forgiving in years past. I've cleaned that up and simplified it, and it's basically just like, this is how I want you to list this stuff out, and just do that. It's not, I think before it had tried to list out specific grants people might be getting, and I think that was confusing. This is just tell me your sources and, this, that, and the other. And I think it's cleaned up, and I think it's relatively easy to use. Let's see. Self-cert, yeah, for the I know we had talked about this. I know, pretty specific question, but yeah, so you'll need to self-cert for the owner, yeah, which I would assume will generally be. I think that should be fine, especially because generally, I know not everyone is in shelter with you guys when they are with the pets are in shelter, but I know they're also in shelter with sometimes with other agencies. A self-cert or something from, I think, their HMIS information generally will work, but we can I'll email me and I'll email you, and I'll post that, in the Q&A document as well for everyone to see. So we covered the self-certs, and that one. Just making sure I got all the ones that. Cool. Alrighty. And so I think there are there Are there character limits for questions where not called out directly in the application? No. And the reason we put character limits in is sometimes we were being lambasted with non-direct information about the specific program being provided, and it made it hard to say, like, which of these services are you actually applying for? And so I guess a lot of this is like, just be brief. Tell us what you're going to do, and do so kind of as directly as you can. When you're talking about your qualifications as a an agency in your application, sure, go for it. But like when you're doing your actual program description, that should be tight and concise. Like I would say you should be able to give me 4 bullet points of what you're going to do and it be understandable, even if it's not really you know what I mean? Like that's kind of like the overview of what I'm like. It just wants a quick summary. We want a summary, and then we do want you to be in the larger section, explain what you're doing, but do so concisely. And that's why the character limit, really. Neighborhood beautification. I will have to look up on how we would qualify that. Yeah, I would have to look up neighborhood beautification projects as how we would do that. I think maybe, like, I know, like you mentioned the public safety. Yeah, I'll have to look into that one further. Thank you, D'Angelo. Yeah. So neighborhood beautification is typically not a public service or eligible public service. The CBDO application is CBDO separate application submission. No, you'll click in your application, and then if you're going to submit it, just attach it or let me know, and you can email those forms directly to me. I know in the last couple of years since we started doing this, I think we've only had a max 3 or no 4. We've had 4, I think, 1 year apply and 3 another. And I would assume in somewhere in that 3 to 6 areas how many. So I'm not really worried about you if you're emailing me those forms. That's cool. That's fine. I'll if Neighborly is being finicky about you uploading extra documents, just email them to me. We'll get it solved. We'll get it all put together. I think that's all the ones in the chat. Did anyone want to raise hand and ask anything directly? Okay, so I make sure I understand. If we are presumed LM income homeless, then we only provide documents for homelessness plus demographics. Yeah, and then when you report, when you do your reporting on, yeah, that's how you do it. You have to certify that they're homeless, man. And then when you report them, all homeless individuals will be reported as extremely low income, so the lowest income category. And I think like seniors are reported as low income, and I would let's see. Migrant farm workers, I think, are low income. Children or abused children are extremely low. Battered adults, DV survivor adults are low income. I have a fuller list, and I can send that to you if you need it. Yeah. For amount of requests, do you recommend a certain percentage of total budget we shouldn't exceed? Not really. I mean, if it makes sense, uh, not really. I think the important thing is it's important that you have other sources. Um, I think that's the big thing is there needs to be a leveraged amount, and then we will look at the leveraged amounts or the stability of the sources, because some, be it committed or uncommitted, you've applied for it, this, that, and the other. Um, but yeah, I mean, well, I certainly wouldn't request more than you need for the program. I guess that would be the my smart guy answer. But yeah, I don't know. I like it's honestly it's going to be a lot of it'll just, I'd say it's just dependent on what kind of your other sources and stuff. Um, But yeah, and also a note on that, like the budget should not be for your entire agency and your entire agency's like funding. It needs to be programmatic. Like it needs to be the budget. That was another thing with the budget issue that we run into. We're like, wait a minute, I that's got to be your annual like amount of money that you have for your entire agency sometimes. So we've run into that. It needs to be the proposed budget needs to be proposed for this program and for these funds and for the other funds that are going to be used that leverage to provide the service, if that makes sense. Oh, are there any glaring differences from last year? Yeah. So I would say the most glaring difference is going to be in, I mean, the questions are different. Um, the in the application, and the scoring is completely different. So scoring is now going to be handled completely in house. Part of the reason that and when I say in house, it will be handled by county staff. It will be myself, Angela, Chase, and likely another member of our team, and possibly I would kind of like to pull someone from another division or department in to get an outside eye, at least one. And we will do that scoring. The reason we moved away from doing the CDAC scoring is one, I think there was a lot of questions in CDAC about the amount of objectivity that they were having to exercise. It also slowed the process way down. And so, you know, we're taking scoring down from a 2 month process to about a week. And it's going to allow our program to move more quickly. It's going to make the funds get out, it's going to get contracts moving more quickly. It's going to move the program a little more quickly. And we're going to just use kind of a set rubric, and we're all going to score and then compile scoring in-house. That's not honestly all that major of a change. We were doing in-house scoring for the vast majority of the points in previous years. We just, with CDAC and frankly the number of applications that we receive for this program, it's super unfair to ask a volunteer committee to look at 30 very large, very detailed applications in, like a week's time. Yeah. Let's see. All right. If the grant money is going to pay staff, but our organization does provide financial assistance for housing needs, do we still need to provide documentation for all of our clients? So it's all of your clients that are going to be that you're serving. So yes, you do have to, if you're reporting them as being served with our funds, even if you're not paying them directly, like the labor that's going to do that, like say you're doing case management or something like that, the client is not receiving, you know, a financial benefit, but they are receiving a service. And so you have to be able to allocate that to the service being provided. Does that make sense? Like if you're doing, if I mean, and now if you can have both of those things as part of your ask too, or part of your budget. Like you could have direct assistance as part of your program. But yeah, I mean, if you're doing fine, if you're doing like if you're providing that, even if it's not directly necessarily our funds, but we're like managing it. I mean, you're still gonna have to income qualify the folks for the service. Um, yeah, if that makes sense. Let's see. Is a small community-based 501c3 eligible to apply? Yes, as long as you can meet all the requirements. If you're a nonprofit, then you're eligible on that end. You just have to be able to meet the administrative and capacity requirements. Yes. And then Angela kind of hit with that. And then as an indirect service provider, we provide weekend food relief to multiple entities, including schools. Drop off the food in sacks in bulk to our partner sites. We don't meet the families directly. We can't collect individual intake forms. Can we just get the total demographic numbers from our partners? Or can we count the sites as presumed benefit as your like total ones? And yeah, I think that's where it wouldn't necessarily hit presumed benefit because just children blanketly are not, or youth are not presumed benefit. It would be, they have to be, I mean, domestic violence survivors generally. Um, oh, 100% of students receive free breakfast and lunch at the school. Well, that would, um, there'd be a way to do this, I think. Let me and Angela talk about what that would be. But I think if you can do, as I think you said, get the total numbers from your partners. Yeah, I mean that's like if you're being kind of a pass through for like food, like that's what you would be relying on for this intake essentially would be your partners. So yeah, we would need that data like Angela just said in the chat, number served. School would need to provide that number and some demographic information. But yeah, that's kind of how we would handle that sort of thing. Because that actually wouldn't be presumed benefit. That would be more like maybe more like nature location. But if they're qualifying for free lunch, they would have had to have done some sort of certification through the school. So if the school is able to, and they don't necessarily, you just have to be able to verify like, yes, that's the school has that data and that you can get it from them if you need it. This, you know what I mean? And that they actually did the intake or they did they have that filed, if that makes sense. Yeah, you're welcome. Right. We've got about 5 minutes left in the meeting. Does anyone have any more questions at this moment? Did I miss anyone's question? If you want to you can just talk or do the raise hand function if you want. So. Is a CBD info part of the application or separate? It's separate. There's a I think there's a question about qualifying as a CBDO or there is a question about do you qualify as CBDO? And yeah, you just download that directly from our website, which is be linked in the presentation. Actually, that'll remind me to download the list so I can hopefully email this out to folks as well. Health and fitness for seniors. It would, I mean, I think broadly that would be something we could fund. I mean, it would depend on what the specific type of activities are. But if it's doing things like, um, I'm thinking senior center type of things, like if you're, providing services like, you could pay your staff that are providing the services, or pay for like materials and stuff. Oh, chair aerobics, yeah, it's likely eligible. But yeah, and those sort of things too. If you've got, maybe it's a basket of services too, that might, those sorts of things can kind of, it's not, if you're doing, like, say you're doing that kind of like, if you're say it's chair aerobics, maybe if you have other programming that's offered to, maybe want to pair that in there as well, to kind of show a wraparound to there. That'll help. And I think that's kind of, even if it's not going to be directly paid, I think um, other, like, in some of those qualifications parts, like talking about the other services that you offer to help support folks that are in your programs, that maybe not be this exact service that you're applying for, but like, hey, they have access to this, that, and the other. That is important. That does show, um, kind of a wider benefit than just like this one thing. Um, yeah. Um, well, let's see. Are there any other questions? Also, like, as it says in the RFP, please email me any questions. If you think of something between now and then. I know stuff comes up when you actually really dive into like filling out the application. So just email us. It says email me. Angie, you can email Angela too, and she'll forward it to me. But yeah, just send me your questions, and if it's like I said, folks, I'm looking for answers for later. I'll be back in touch with you, and then the same thing with that, and then I'll put all of this into the Q&A doc so everybody has it. And outside of that, if I have no more questions at this time, I will for once give you back some of your time, which I'm not really known for. So, all right, fantastic. Well, thanks everybody for listening to me go on for an hour and a half about this program. Send me your questions, and I look forward to looking at your applications. Thanks so much.